I'm a physical therapist, and I'm a certified athletic trainer and a strength and conditioning coach. I've been involved in sports medicine as a student athletic trainer dating back to when I was in high school. So I've been involved in this field for over 40 years. And after physical therapy school, was involved with intercollegiate, high school, and the professional level, in addition to the Olympic experience that I've had. So being with the Celtics, going into my 29th year, the roles have obviously changed, and because of the experience that I have and some of the different degrees that I have, having my doctorate in physical therapy, it's important with some of the research that's out there, and so that what we're applying is evidence-based practice, and we're not just doing anything because a player happens to like it. And that's where NormaTec comes in also as an example, that they have the science behind it and they continue to do research. Intermittent compression units have been around for many years. NormaTec, a local company, came in with a new unit for us to try many years ago, and I say many, probably about 5 or 6 years ago. So it was fortunate for us that they were here. We were able to utilize them, and their units they have segmental units, okay, on the same appliance as opposed to the whole appliance inflating all at once. Over the course of time, the field of sports medicine, athletic training has expanded into different areas. Years ago, the athletic trainer was also involved, say, in developing strength and conditioning aspect. So one of the things, so with the evolution of sports, things have become more specialized. So one of the things that, over the course of time that you've seen is that regeneration and recovery is another component, another sphere that we need to evolve into also. So in addition to nutrition, in addition to conditioning, in addition to the immediate management of injuries and the rehabilitation aspect of it also, recovery and regeneration are a big aspect of what we need to do, and especially in a sport like ours where we have a compressed schedule of 82 games and somewhere in the vicinity of about 170 days. So that's important for us. Within the recovery room, and we set this up, there are many aspects to it. And for recovery and regeneration, warm whirlpools, cold whirlpools, biofeedback units, lower your heart rate down. We also have a full-time massage therapist, and we've had that for years. So as an adjunct to that is the use of the intermittent compression units that NormaTec provides, and it's been a great facility for us to build this out to separate the players away from the hustle bustle of the locker room, the court, the training room. So mentally they can decompress in here, but also physiologically when we're working with the different modalities to help with recovery and regeneration. It's difficult to play 4 games in 5 nights. It's difficult to play 5 games in 8 nights. So we have to look at every different area that we can. That's why we look at nutrition, rest, massage, biofeedback units in order to do that. And with this NormaTec in here, it's been well received. We keep track, obviously, as anybody would, of the use of modalities, our treatments that we do, and we saw a spike and an increase once this room was created. The other aspect that, using NormaTec as an example with their intermittent compression unit, is that it can be used for recovery, but also post an acute injury, post-surgery, in order to decrease edema, swelling, within a particular joint. There are garments for your lower extremity, there are garments for your hip, garments for your upper extremity. So we will utilize it that way. The advantage of, say, with the NormaTec is there are different settings that you can put on the unit itself, so that we can progress from a light compression to an increased intensity. We can change the time. It's very flexible in that aspect. And what will happen is that over the course of the first 2 minutes, it'll set itself, and then the units will segmentally fill up. And it'll go through a cycle with the goal of pushing the fluids, pushing blood, recovery, also that peristaltic sensation, giving a little bit of a massaging effect to the athlete. The units are small enough to also travel with, which is a great advantage for us, whether it's in my hotel room or the player's hotel room or on the plane also. That's a battery-operated unit that just needs to be recharged instead of having to be plugged in all the time, which is super. Now that's been an advancement within the company, which is nice. So the company just isn't static. We're always looking to either improve the unit or do the research to support what they've done and why they're selling it. One of the advantages that this unit provides is I'm able to customize it to each player. Okay, so that when they come in on a particular day, I'm able to either increase the intensity, lower the intensity, or I'm able to also change the time. I'm able to only use it on a certain part of the body. So if I had a leg unit on, I might only want the foot and the ankle for an acute injury. I can also program it just for that. Or I can program it to have, say, all 5 segments of use. All within there, if I need an increased compression in a particular area, I'm able to program that and get a little boost in just that area also. The other advantage on this is also that you can just have, there are 2, at this Y junction, there are 2 coming off, but by just flipping a switch down here, you can only have to say, maybe only have to use just 1 leg, okay, and 1 appliance, which is a great advantage in the rehab situation. Recognizing the need several years ago, for that, that athlete, not only for return to play, but as been described, what's the best ability is availability. So within the course of the season, as your body begins to break down, we need to push that threshold a little bit higher, okay, of when will that individual need to, rest before fatigue sets in and deconditioning sets in. So a few years ago, we dedicated, an area, and then with the introduction of NormaTec, the ability of the team stepping up and buying a cold whirlpool and a warm whirlpool for immersion, we encompassed it all into one area. So there was a great advantage to that. We were one of the first, if not the first, to dedicate in the NBA to dedicate a separate room to that. And the field is just going to expand as research, evolves, and that we look at different areas, whether it's with biomarkers, whether it's with biometrics and tracking them out on the floor when we have to adjust their workloads and joint loads. That's one aspect of it. The modalities that you have to use are another aspect of it. So there's the prevention of it, there's the management of it, and it's been a great component so that when our players are out there, we're trying to put the best athlete at his peak at that particular time out there that he can.